with Dr. Badillo, Dr. Knox, anesthesiologist, Jeremy, and Kelsey, I'm sorry. So we did a maxillary arch chrome. We're also going to do a mandibulary arch in a month. Dr. Knox, could you tell us, what, in your opinion, what you thought of the whole procedure, the surgery, and with anesthesia? You know, what do you think of these chrome surgeries?
As the sedationist for this procedure, I think it goes really smooth because of the fact that everything is laid out step by step for the surgeon. It just really streamlines the process and cuts down the amount of time that we have to sedate a patient, and it just makes it a lot easier, I think.
Thank you so much. Dr. Badillo, what did you think of today's surgery?
You know, I thought it went fantastic. We had such a rock star patient, and you know, the ease of the guided surgery just makes a world of difference. I've done this both ways and there's no comparison. You know, having all the resources ahead of time, having everything planned, knowing exactly where the implants are going to go, and being able to deliver this beautiful smile the same day is life-changing, I hope. For the
Excellent. Jeremy, you guys, Kelsey, what did you think of the procedure?
It's great. I think it went smooth there. Great patient. She does laugh. So.
And then, what did you think? How are you feeling? You just got the upper done. That's you.
Yeah, I'm a little groggy, but in a good way.
Awesome.
And so far, so good. I was extremely nervous. I'm sure I've been a pain in the rear earlier, leading up to this, because I'm so anxious. But you all put me at such ease that I was laughing at myself for being so anxious. And I'm thrilled so far with the results.